Hi, I'm Ken Donaldson, Senior Research Fellow in the Surgeons' Hall Museums, and I'm here with another tale from Surgeons' Hall. This one's entitled The Fastest Knife in the West End. 7 facts about the Edinburgh surgeon Robert Liston that you didn't know. Edinburgh in the late 19th century, in the wake of the Scottish Enlightenment, is celebrated for the development of a humane and scientific approach to medicine and surgery. Amongst the most famous surgeons who worked in Edinburgh and contributed to these advances are Lister, Bell, Simpson, and so on, but none was more famous at the time in wielding the knife than Robert Liston. In an age where there was no anaesthesia or no antisepsis, then the faster the operation could be completed, then the less was the agony for the patient, the less likelihood of infection, and the less likelihood of blood loss. The figures speak for themselves. Between 1835 and 1840, Liston performed 66 amputations and only 10 died, which is good figures compared to the 50-50 death and survival which was common for surgeons at that time. Liston had a powerful physical presence and a strong and principled personality. And here are 7 facts about Robert Liston, the famous surgeon that you didn't know. Fact number 1. Liston had completed his medical training and was employed as a house surgeon in the Royal Infirmary of Edinburgh at the age of 20. This is a remarkably young age for someone to be taken on in such a complex job of general surgery in a very busy hospital. Fact number 2. Liston was an imposing figure at 6 foot 2 inches tall at a time when the average height of men was 5 foot 5 inches, and he used this physical presence when he needed to intimidate and argue with people, and he was undoubtedly arrogant. He openly disapproved of surgeons who did not come up to the standards of surgery that he himself possessed, and that's to say most surgeons, because he was the best really. He argued for better anatomical training and knowledge in surgeons in his book Practical Surgery, where he wrote, "Many poor creatures have been sacrificed in consequence of the ignorance and carelessness of scientific professors who have either despised or neglected the study of surgical anatomy." Fact number 3. Liston had a famous altercation with Robert Knox, the greatest Edinburgh anatomist of the day. Liston was suspicious, as were many others, regarding the supply of fresh corpses to Knox for dissection in his classes, and he suspected that Burke and Hare were involved and that murder was afoot. Liston had heard that Knox was displaying the body of the beautiful Mary Patterson, one of Burke and Hare's victims, who had been a prostitute visited by Knox's students. He went to Knox's school to confront Knox and was so outraged at seeing Mary's body being displayed in a voyeuristic way that he knocked Knox to the ground and took the body of Mary Patterson away for a decent burial. Fact number 4. At the age of 34 in 1844, and following a number of disputes with the Edinburgh Royal Infirmary, including one where he was briefly banned from the premises, Liston left for London to become Professor of Surgery at the new University College Hospital. In this post he became even more famous for the skill and speed of his operations, and he earned the nickname the fastest knife in the West End. He would pick up his knife often in front of visiting surgeons who were keen to learn his technique, and he would call out, "Time me, gentlemen, time me," before proceeding with the operation as the onlookers set their watches and timed him. Fact number 5. Liston's amputation above the knee could be accomplished in 30 seconds using a number of new approaches that Liston developed. Instead of cutting inwards around in a circular motion through the skin as did other surgeons at that time, before reaching the bone, he had a special knife made that was sharp on both sides. He slid this in till it met the bone, the femur, and then cut outwards through the muscle and soft tissue, leaving a longer U-shaped flap of skin on one side. After sawing quickly through the bone, this flap would be folded over the cut end, forming a skin-covered stump. Fact number 6. Liston performed the first operation in Europe where a patient was rendered unconscious by the use of a new method of ether anaesthesia, the forerunner of chloroform. In December the 21st of 1846, a patient named Frederick Churchill required the above-the-knee amputation. Having heard of its use in America, Liston's assistant used ether-dampened cloth to render Churchill unconscious, and the amputation was performed by Liston in about a minute, during which the patient awoke to an extent but was too groggy to feel any pain. As he further emerged from the anaesthesia, the patient exclaimed, "When are you going to begin?" This was greeted by such laughter from the students and observers of the operation that the patient shouted out, "Take me back, I can't have it done." Fact number 7. There are 3 operations that Liston carried out that became really famous. First, he removed a 45-pound scrotal tumour that the patient carried around in a wheelbarrow. Secondly, he amputated a leg in 2.5 minutes, but in the excitement and speed of the operation he removed the patient's testicles as well. But his most famous case, without doubt, and is possibly apocryphal, but anyway, the operation was called the operation with 300% mortality. The patient's leg was amputated in under 3 minutes, but Liston also amputated a few of the assistant's fingers. Both the assistant and the patient died of sepsis a few days later. Meanwhile, during the operation, one of the spectators, a surgeon, was so close to the action in order to get a good view of Liston's procedure that Liston sliced through his coattails and the man promptly had a heart attack and died of fright. The operation with 300% mortality.